pretty amazing. The laser has been made so that it'll actually go after the bacteria in the pocket, and it's specific to the type of bacteria that cause gum disease. So when you use that laser, it literally will sterilize around the pocket and kill the bacteria. That's how it works. It also uses the light of the laser to actually energize the bone and the tissue that heals, and it allows it to heal faster. If you don't do LANAP treatment, you most likely will lose your teeth, because if you're coming to see me for LANAP, you usually are pretty advanced and you don't have much time left. So I usually find if you don't do anything, you're going to lose your teeth. In most cases, it will. Through the years of doing this, we've had really excellent results. Sometimes you'll lose a few just because they're so badly damaged, but the majority of them you'll be able to save. LANAP is a lot different because we use a laser to do a lot of our procedure, and the laser is so small that it's very, very nice to the gums. We don't have to use scalpels and sutures to hold everything together when we're finished. We actually just use the laser and it'll actually heal it on its own. Well, if you follow the protocol that you'll be taught after you do the procedure, you shouldn't have to have it done again. In some rare cases, you may have to. You might have to go back in and retreat certain sites, but a majority of the patients that I've seen haven't needed to have that done afterwards. Usually, it depends on how much is needed, but normally if it's your full mouth, we do two parts. One half of the mouth one day and the other half the other day, and it's usually about an hour and a half. Oh yeah, it's like a normal dental procedure where you would have anesthetic. You will be totally fine after you're finished. It's about an hour and a half appointment, so you might be a little tired, but you should be totally fine to drive yourself home. It depends on if you want me to write you a note and get out of work. No, just joking. The amazing thing about it is it seems like a very complicated procedure, but actually for you, you can go home, you can have a normal day, you can go right to work. You may be anesthetized, so people may make fun of you, but outside of that, you should be totally fine to go back to work, resume most of your normal routine.
Great.
Actually, it's really amazing. Considering what we're doing for you and the surgery that we do, you won't have much pain at all. Some people may need a Motrin afterwards, an ibuprofen, but most cases people are like, call me the next day asking, when am I going to be in pain? And they aren't. That's the pretty neat thing about it.